Dr. Perry, tell us what's going on. Paint the picture in your area right now when it comes to COVID.
Sure. And thanks for having us on this evening. We greatly appreciate the opportunity. First, we are continuing to see cases develop. We have begun to see the number of cases start to decline. We're seeing the number of EMS runs start to decline. But, the one thing that I would caution and kind of piggyback on what Dr. Gupta is saying is that, healthcare systems and providers and healthcare workers everywhere are still reeling from this first wave. And the thought of opening things up too quickly frankly, it makes us nervous in a lot of different ways. We still have many healthcare workers just now returning to work after having combated this virus themselves. Healthcare providers, staff, they're wore out from dealing with this and haven't had a break for 6 weeks, 8 weeks or more at this point. So locally, though, we've been very well prepared. Luckily, we've had great leadership. We've had great preparation. We've had great engagement from our staff. Right. We've had great support from the community.
Dr. Gupta, I'm curious about the issue of healthcare workers and the issue, frankly, of the financial security of hospitals. No elective surgeries means that's a financial lifeline that is gone right now. How concerned are you about this, a financial crunch, then suddenly impacting the ability to have medical workers on the front lines?
I think my anesthesiology and surgical colleagues are taking a hit, but they're going to be fine. I worry about our ancillary staff, our respiratory therapists, our nurses, and maybe not necessarily the ICU or the emergency room, but our surgical techs. People that we need to run hospitals and run them safely, they are hurting right now. And so it's a big deal in terms of who we're furloughing, who we're letting go. My wife's a pediatrician in a clinic north of Seattle. They had to let go a lot of their staff, a lot of their MAs. And so who's to say when they'll be able to come back and restaff these clinics? How are we going to get to full operations? It's a big, big problem. I think doctors are going to be just fine, but it's everyone else that I'm really worried about.
Dr. Perry, you sort of set this up interestingly. You said, all right, the good news is I think we've got some things are bending downward in your area, but you're worried about the relief to your healthcare workers. Talk to me about the fall. Do you think you're prepared for a double whammy of the flu and COVID at the same time?
Well, moving forward, I hope that this affects the preventative health measures in several ways. Number one, as we do move into the fall, I hope we see more people take advantage of the influenza vaccination. By doing that, we can at least mitigate that influenza-like illness, flu outbreak. So that would be very important. But yes, I think one reason this hit so hard and so fast, first, it has to deal with the infectivity of this virus, the virulence of this virus, but it also hit us at a perfect time in the winter when people are together. The respiratory epithelium is more at risk for viral penetration, and kids are still in school. So we're going to return to those same type of situations in the fall. And unless we have point-of-care testing, unless we have early effective treatment to prevent the progress from early mild disease to severe, unless we have vaccination, prophylactic treatment for people with exposures, we'll be dealing with the second wave. Now, hopefully, we have a buildup of PPE, equipment and supplies, but we certainly expect it, and it's going to look like flu, and it's going to be difficult to ascertain that.
Dr. Gupta, would it be easier if our political leaders simply said, look, there's going to be a mild respite this summer in some form, but we can't reopen the country completely, but we could lighten it up a little bit, but you got to be prepared that the fall could be harsh if we don't practice social distancing, things like that. Is there a compromise of sort of doing a relief valve a little bit this summer and then closing it in the fall that's realistic and less harmful to us both health and economically?
Yeah, a few things, Chuck. I mean, first of all, you just talked about hydroxychloroquine and the scientist that was fired. I think we can talk about safety if we start messaging and the president starts messaging on what's evidence-based. So that's number one. Let's all wear masks in public. That needs to be a key piece. I anecdotally don't see enough adoption of it here just in Seattle when I'm in public. Okay. So that's number one. Let's try to get plasma where it needs to go. Only 20 some odd units are actually infused in patients that need it. The government can help. When it comes to actually getting people back to work, though, yeah, to your point, I think we should focus less on what's essential and what's not essential, maybe more on what's safe, what's not safe. So people that are manning car washes, for example, I've heard is a great example of that's actually safe. Maybe we can do car washes because that's all automated, and we should be able to bring back more people into the workforce because there's social distancing and we can ensure public safety. So we should broaden, be flexible about what is safe, what's not safe, and then institute evidence-based practices.
Well, that's a good way of putting it. What's safe and not safe, rather than essential, not essential. Anyway, Dr. Perry, thank you.